Hello, my name is Mallory Finley, and I am a Master of Public Health student in the Health Promotion and Education track here at Liberty University. My practicum experience took place at a company called Genea, which is located in Harrisburg, Pennsylvania. If we look at the next slide, you will see that Genea is a healthcare and analytics solution and services company that's focused on improving outcomes, reducing cost, and restoring the joy of medicine to physicians. Genea offers a suite of solutions to common problems in America's health delivery system today. These services are offered to support hospitals, health plans, integrated delivery networks, physician practices, and employers who are engaged in value-based systems in better identifying and managing risk, utilization, and overall cost. One way to do this is by engaging with Theon, which is a software program that was designed by Genea. Theon delivers key insights into various aspects of healthcare, including provider performance, patient risk, and the total cost and utilization of services. Theon has predictive capabilities to guide early and targeted interventions toward at-risk populations and to improve treatment outcomes. At-risk populations that are looked at by Theon include those generally with chronic diseases. Another facet of patient management and care that Genea offers is called At Home. This remote patient monitoring program combines predictive analytics, state-of-the-art remote monitoring technology created specifically by Genea, and in-home care management and clinical support to better manage chronic conditions. Active management of client populations through clinical services is achieved through a value-based relationship. This relationship takes place between a registered nurse or other qualified healthcare individual at Genea and the patient that is either an employee or previous employee at a company that had either Capital Blue Cross or another health insurance company that works with Genea. Genea's clinical team directly coordinates care and provides a variety of services and support, including health and wellness programs and initiatives for health plans and employers, as well as patient outreach to close care gaps for hospital and provider systems. Consulting and professional services are in place to ensure that the client is getting the most out of Genea's services and everything that is offered, while the training and education services ensure that the client's employees are staying up to date with the latest advances in medical technology. These training and educational services can also be used as continuing education credits for healthcare professionals. My role as an intern with Genea was to work as a health education specialist within the Department of Health Education and Wellness, as you will see on the next slide. The Department of Health Education and Wellness primarily serves Genea's biggest client, which is Capital Blue Cross. This department is responsible for delivering health consultation and education services to any company in Pennsylvania that offers Capital Blue Cross health insurance to their employees. These services can be given to any employee at these companies, whether or not they are a Capital Blue Cross member holder. The Health Education and Wellness Department is made up of 9 staff members. The department director, Kelly Brennan, oversees the department and coordinates interdepartmental collaborations within the company. Kelly is also responsible for maintaining satisfactory relationships with Genea's clients. The department manager, Nicole Lindsay, directly supervises the rest of the department staff in their day-to-day workings and responsibilities. Nicole holds monthly meetings with the whole department, and then weekly one-on-one meetings with each staff member to check in and see how their work's going and how she can be of help to them. Nicole also collects client evaluations from interactions with each staff member and reviews the employee's performance. Consultants in the Health Education and Wellness Department are responsible for meeting with clients periodically throughout the year to discuss how wellness programs are going and review the worksite's employee health status using data from Theon. Theon gives employers a snapshot of areas that their employees are doing well in and areas where their employees can improve health-wise. Generally, this includes chronic diseases such as diabetes or pain management. The registered dietitian in the department goes to each work site up to twice a year to do a healthy cooking demonstration or a basic nutrition workshop. A healthy cooking demonstration can involve showing people how to prepare a healthy meal that's centered around a theme. These themes generally include healthy holidays, healthy eating on the go, back to school lunches, or seasonal dishes. The department's personal trainer offers 30-minute training sessions to Capital Blue Cross members at a gym located in Harrisburg. She also conducts wellness classes that are called Empower at client work sites that focus on physical activity, nutrition, and other habits for cultivating a healthy lifestyle. Finally, the health education specialist is responsible for delivering educational presentations and exhibits as requested by the client. Generally, the client will try to request educational exhibits or presentations that relate to areas that were identified in Theon and discussed with the consultant that their employees could improve on. My role as an intern within the department, as you will see on the next slide, was to serve as a health education specialist representing Capital Blue Cross. This role required me to do a variety of activities centered around health promotion and education in the workplace. One task that I had to do was create health education materials for employers to display or distribute within their company. A way that I did this was by creating something called stall stories, which were focused on preventive screening measures and can be hung on the stalls of doors in employee bathrooms. There were 12 stories that were created and featured a made-up scenario relating to a primary health screening, such as different types of cancer, cardiovascular disease, autism, diabetes, blood pressure, cholesterol, and other measures that are recommended by the Centers for Disease Control and Prevention to be screened for among patients on a semi-annual basis. I was also tasked with creating short informational presentations that could be accessed by Capital Blue Cross members via the Capital Blue Cross member portal. These presentations were geared toward patients with a newly diagnosed condition and offered basic information and support for the individual. Conditions that I was able to create a presentation for include heart disease, type 2 diabetes, asthma, high blood pressure, and obesity. I also created general healthy living presentations that were focused on nutrition, physical activity, stress management, sleep, and child well-being. My major responsibility as an intern was to travel to work sites that offered Capital Blue Cross insurance to their employees and conduct either a health exhibit or 60-minute health presentation. Different exhibits and presentations that I delivered were focused around alcohol awareness, asthma, blood pressure, cancer detection, chronic pain, heart disease and cholesterol, sleep or stress in your health, mental wellness in the workplace, and tobacco cessation, which could include the American Lung Association Freedom from Smoking program. I am very grateful for my experience with Ginia. I was able to learn a lot about the health education and promotion and gain valuable experience in the field. On the next slide, I've outlined strengths and opportunities for growth that I was able to identify within the organization. Ginia was rated as one of the best places to work in Pennsylvania in 2017, and during my time as an intern there, it was easy for me to see why. All employees are allowed to work from home once a week, and managers and directors are allowed to work from home twice a week. The company runs on 7.5-hour days and offers generous paid time off to new and veteran employees alike. The office building has a full gym with cardio machines and weights, which makes it easy for employees to fit physical activity into each day. There are also standing desks at each employee workstation and several walking treadmills on each floor of the company's building. The department that I worked in had a great teamwork ethic and was committed to working with one another and supporting all events and responsibilities together. Jania had a great overall communication system through email and through phone, and the materials that they provided the health education department with were really great for explaining different chronic diseases to patients. Some opportunities for growth that I identified included tailoring presentations to different work sites. Sometimes I felt like the presentations were either too basic or too high level for the population that I was presenting to. And another opportunity for growth that I identified was to create more interactive health exhibits that would draw people over to the table and keep them engaged the whole time. Thank you.